Safety reminder devices. A safety reminder device, SRD, is defined as any of the numerous devices used to immobilize a patient or part of a patient's body, such as arms or hands. Many facilities have adopted a restraint-free environment, thus eliminating the use of any type of SRD. This is especially true in long-term care facilities. The long-term care setting is the permanent home for many residents, so maintaining a safe environment while protecting the individual's dignity is a priority. The use of SRDs also tends to result in increased restlessness, disorientation, agitation, anxiety, and a feeling of powerlessness. It contributes to patient immobility and associated problems with immobility such as dehydration, healthcare-associated infections, and incontinence. The resulting disuse of body parts has the potential to increase disability and lead to further patient weakness and unsteadiness. Patients often pull against the SRD, causing skin and circulation problems. SRDs may be used for various reasons, but are primarily for considerations of patient safety. SRDs that restrain the use of limbs, like a wrist restraint, are used primarily in the mental health setting to protect the patient and staff from harm. Pediatric setting to prevent such incidents such as displacement of IV lines by the patient. And the intensive care setting to prevent the patient from pulling out medical devices such as an endotracheal tube. Certain patient populations, such as the disoriented patient, are more likely to need SRDs in the forms of bed or chair alarms. A bed or chair alarm alerts the staff if a patient attempts to get out of a bed or a chair without assistance. This helps reduce the risk of the patient falling from a bed, chair, or wheelchair. For patients or residents in a long-term care setting who are at risk for elopement, leaving the healthcare facility without permission or necessary supervision, a device referred to as a wander guard may be needed. This device is worn on the wrist or ankle and sets off an alarm when the person leaves the facility. These devices are especially beneficial for those confused or disoriented patient or resident who will be at risk for attempting to leave the facility. The focus of patient care is on attempting alternative strategies before turning to the use of SRDs. By assessing individual patient needs, characteristics of the environment, and organizational change, the LPN often is able to plan interventions that reduce or eliminate the need for SRDs. Patient safety and safety of others are the only reasons an SRD is used, and most require a specific order from a healthcare provider. Some facilities require that a healthcare provider order for SRDs be renewed every 24 hours. Explain to the patient the need for the device, even if the patient doesn't seem to understand the explanation. Also, inform family members about the need for SRDs. Include information about the specific device used and the approximate period for use. Documentation about the need for SRDs, the type of device used, and patient's response is crucial. Perform a comprehensive assessment that focuses on the patient's behavior, activity, and skin condition. Note all nursing interventions, including patient and family teaching about the SRDs. Older adult safety. Physiologic changes in aging increases the need for safety precautions. Changes in vision, including altered depth perception, increased sensitivity to glare, and decreased visual acuity in dim light, increase the risk for falls because of misperception of visual cues. Changes in hearing, including varying degrees of deafness and tinnitus, ringing in the ears, increase the risk of injury from hazards in the environment because certain warnings that are commonly detected with auditory cues, such as motor vehicle horns, alarms, or even spoken warnings, are not heard. Prevent sensory overload in older adults because reflexes and the ability to respond to multiple stimuli slow with aging. Changes in muscle strength and joint function that result in slow reaction time, altered gait, and altered sense of balance make it more likely that stumbling will result in a fall. Changes in the cardiovascular system, such as anemia, orthostatic hypertension, and heart block, increase the risk of syncope, which increases the risk of falls. Changes in the peripheral vascular system sometimes result in loss of sensitivity to heat, cold, or foreign objects, which increases the risk of tissue damage from burns, frostbite, and pressure. Older adults take many medications that increase the need for safety precautions. Sedatives, hypnotics, and tranquilizers affect reaction time and increase the risk of injury. Antihypertensives, diuretics, and antihistamines increase the risk of orthostatic hypertension, a drop in blood pressure, which increases the risk of falls. Keep to a minimum the use of SRDs with older adults and, when necessary, the amount of any restraint used. SRDs reduce mobility and result in a loss of strength that can increase the risk of falls or injury. Accidental poisoning is a significant problem in older adults. Visual changes raise the potential for misreading of labels on medication or other package labels and lead to overdose or other errors in administration. Medication organizers or dispensers help reduce the risk of medication errors in the home. In addition, many older adults do not consider over-the-counter medications to be real medicine, so they take them freely and fail to mention them when questioned regarding drug use. Many over-the-counter medications increase the risk of injury to the older adult by potentiating or interfering with the effects of prescription drugs. Designing a restraint-free environment. Care of the patient who may be prone to threats to safety and security require a creative, systemic, and attentive approach. A wide variety of electronic devices have been developed to alert staff to a patient's need for assistance. A weight-sensitive alarm can be placed under a patient's bed or in a chair. When the patient tries to get up, an alarm sounds. A chair alarm may be used to remind the patient or alert the staff when a patient who requires assistance when standing or ambulating tries to get up without assistance. To design a restraint-free environment, orient the patient and family to surroundings. Explain all procedures and treatments. Encourage family and friends to stay or use sitters for patients who need supervision. Assign confused or disoriented patients to rooms near the nurse's station. Observe the patients frequently. Provide appropriate visual and auditory stimuli like family pictures, clocks, or radios. Eliminate bothersome treatments as soon as possible. For example, discontinue tube feedings and begin oral feedings as quickly as the patient's conditions allow. Use relaxation techniques, massages. Institute exercise and ambulation schedules as the patient's conditions allows. Encourage participation in diversional activities. Long-term care facilities typically have daily activities planned for the residents, such as games, movies, entertainment. Maintain toileting routines. Consult with physical and occupational therapists to enhance patients' abilities to carry out activities of daily living. Evaluate all medication patient is receiving to determine whether the medication is having the desired therapeutic effect. And conduct ongoing assessment and evaluation of patient cares and patient's ongoing response to care. Long-term care variations for safety reminder devices. Legislation has affected greatly the use of safety reminder devices in a long-term care facility. Under the Omnibus Budget Reconciliation Act, OBRA of 1987, residents' rights are addressed specifically in terms of SRDs. This act, effective October 1st, 1990, mandates specific guidelines and prohibits routine use of SRDs in long-term care facilities. The act regulates the use of extremity SRDs, hand mitts, safety vests, and wheelchair safety bars. SRDs may be used only to ensure physical safety of the resident or other residents. A written order by a physician must detail the duration and circumstances under which the SRDs are to be used. OBRA states the following as acceptable reasons for the use of physical restraints. All other interventions have been attempted before the use of restraints. Other disciplines have been consulted for their assistance. Supporting documentation has been completed. Essentials of SRD documentation. Reason for the physical restraint. Explanation given to the patient and family. Date and time of the patient's response to treatment. The duration. Frequency of observation and patient's response. Safety. Release the physical restraint at least every 2 hours. Routine exercises of extremities include range of motion exercises. Assessment for circulation and skin integrity. Assessment for continued need for the physical restraint and the patient outcome.